Hi there, my name is Caleb Lay, and today I will be talking to you about epilepsy and its workplace implications. So, what is epilepsy? Epilepsy is the fourth most common neurological disorder. It is a disorder in which nerve cell activity in the brain is disturbed, causing seizures. Epilepsy may occur as the result of a genetic disorder or as an acquired brain injury, such as from a trauma or a stroke. It affects people of all ages, even children. About 50 million people worldwide have epilepsy as of July 2019. Here in the United States, however, according to the CDC in 2015, approximately 1.2% of the population, or 3.4 million people, nationwide have active epilepsy. 1 in 26 people in the United States will develop epilepsy at some point in their life. So, what does epilepsy look like? What are the type of seizures that it has? There's a common misconception that seizures always mean convulsions. Convulsions are the violent body shaking that we see in many types of seizures. Seizures sometimes don't involve these convulsions, but instead have confused spells or staring spells in which the patient loses voluntary control over their eyes and mouth movement. They cannot comprehend speech and can only stare in a confused daze. In fact, there are two main types of seizures. First, focal seizures. These are seizures that start in one part of the brain and spread to other areas. With these type of seizures, there is a rapid yet gradual build up to climax in brain sensations as neurons fire chaotically. Epileptic patients are able to identify these onset of symptoms in focal seizures, referred to as an aura. These are leading up to the main seizure event and may include smaller symptoms of confusion, minor shaking, muscle stiffening, and fumbling or chewing motions. The patient may also lose consciousness in what's known as a focal unaware seizure, but this is not a requirement for this type of seizure. In a focal aware seizure, the patient will not lose consciousness but will experience some or all of the symptoms I just mentioned. Convulsions may or may not take place. Again, these are the violent body shaking motions. The second main type of seizure is what's known as a generalized onset seizure. These are seizures which are generally more violent in nature, that consists of convulsions and a higher risk of involuntary self-harm. These seizures have a higher risk of occurring if the patient consumes high amounts of alcohol regularly, experiences sleep deprivation, or undergoes large amounts of stress. As such, they have more of an environmental factor factored into them. My seizures, as someone with epilepsy, are what's known as tonic clonic, which are a combination of everything I have just mentioned. I experience the aura and the weird sensations, but I also lose consciousness and I have convulsions. So, what are the implications of seizures in the workplace? Well, the best way anybody can help someone who does have a seizure in the workplace, who does have epilepsy in the workplace, are as follows. Number 1, removing all furniture and objects from around them. This will ensure that if they fall or if they lose consciousness or they experience convulsions, they will not hit their head or accidentally grab something sharp and hurt themselves with them, involuntarily, of course. Number 2, if they experience a seizure in the workplace and lose consciousness and fall, catch them. If you can, catch them and then sprawl them out on the floor if they lose consciousness while their seizure undergoes. If you cannot catch them and they do fall, again, remove all objects around them to ensure their safety. Number 3, contact emergency services if they are unknown to be epileptic or if they previously specified to do so in the event of a seizure. Just because someone has epilepsy and most likely undergoes treatment does not mean that emergency services should not be contacted. If they specify to do so, again, or are unknown to have seizures, contact emergency services and explain the situation to the paramedics. If the patient does not experience convulsions but experiences auras or confused spells, be patient with them. Give them space and give them time. Seizures cannot be stopped, nor can attention be returned to the patient before the seizure ends. If someone does have a seizure in the workplace, they may be experiencing sleep deprivation and or intense levels of stress. Management should liaise with human resources to decrease their workload while they recover. In conclusion, this is a brief overview of epilepsy and its implications on the workplace. The best way to help anyone with epilepsy is to be patient and be understanding with them. I know that's what I would appreciate more than anything. Thank you.